Good afternoon. It's Friday afternoon, the 17th of April. I'm Alan Vandriel, the CEO at Smith County Memorial Hospital. With me is Sarah Ragsdale, our Chief Nursing Officer here, and we're here to present just a quick community update of happenings this week and advice for the community. As I think probably most of you know by now, we did have this week our first two confirmed positive cases of COVID-19 in Smith County. The immediate question that comes to mind for most people when they find out that we had a positive case is, what does that change? And the short answer is nothing. We anticipated that this would happen. We've been anticipating that for some time, that we would eventually have a positive case. And we had put safety measures in place at the hospital, and there were safety measures in the community for how to deal with a COVID positive patient. Our staff is reacting well to the situation. We have put obviously visitor restrictions in place at the hospital. We've put screening procedures in place so that everyone who comes into the building now is screened. We feel very confident that there is no greater threat to anybody in the community, our staff or visitors or patients to the hospital, than there was prior to identification of these positive cases. While we believe that this situation is as safe as we can make it, the other piece that comes to mind when the public is notified that we have a positive case is the question of, how does the public get notified of this and what is the risk to individuals in the community? So I want to talk just a little bit about the process for when we have a positive case. When we're notified by the reference lab that does our testing for us, we immediately notify the Smith County Health Department that we have a positive case. And it is the role of the health department to carry out an investigation to determine what the source of that investigation is as best they can. So they're going to contact the person who tested positive, and they're going to ask them questions about travel history. They're going to ask them questions about people they may have been in contact with who have had symptoms or may have had symptoms of COVID disease. They're going to talk with them about people they've been in contact with who they may have passed the virus on to. All of that is done by the Smith County Health Department, and they do a very good job of that investigation. But the bottom line to it is that people who are believed to be at risk for exposure to COVID-19 as a result of us having a positive patient will be notified by the health department of what actions they need to take as a result of their involvement. If you have not been notified by the health department that there is something that you need to do, then you're not at risk and you need to do nothing more than what you have already been doing to protect yourself. We do want to ask and comment on the privacy related to the presence of a positive case or cases. As I said, we notify the health department. The health department does the investigation. We do not release any information about who the patients are that we have tested, who the patients are who may have been positive. That all is the role of the health department to do. It does the community no good to have speculation going on in the community about who the positive patients are, or whether individuals that have not been contacted by the health department are at risk. We don't need people being stressed. We don't need people worrying about their status as far as this is concerned. The process works. It will work well. I have confidence in the health department. I have confidence in our staff. And so if you have not been contacted by the health department, there should not be any greater risk to you than there was prior to us identifying a positive case. I want Sarah to talk just a little bit about the ongoing measures to protect yourself that you should be taking anyway.
The best things that we can do is follow the guidelines the CDC has given us. the opinions of your healthcare providers and the health department, where you should stay at home, only leave for essential items, practice social distancing when you're out in public, and good hand washing measures. Help us take care of you, our coworkers, and our families.
So it's Friday afternoon. It's a good day. The sun's shining. We want you all to have a good weekend and be safe. Thank you.